This is the expansive, breathtaking and vibrant coastline of Kilifi County. Beneath it are dark, swollen secrets.
Nilelewa Chakari. After that, tulienda kwa room. Nikaenda kushawa. Immediately baada ya kushawa, that's when he raped me.
Uko class ngapi?
6. Kuna kijana amesema nipenda, akamwambia sitaki. Akawa analazimisha. Ukaendelea hivyo, hao watu wa nyumbani wakajua. Kuna jirani yangu mmoja huko ni uncle yangu, aliniita akanipiga.
So it was such a horrible act and ilinisumbua kwa muda mwingi sana. Nilikuwa imefikia wakati natamani kujua all of that incidents.
School dropouts, high rates of teenage pregnancies, early marriages and HIV infections among adolescents and young women are common here. While violence against women is both a global and national problem, Kilifi County has one of the worst prevalence rates in Kenya.
Kilifi County is one of those that have got high prevalence of teenage pregnancies and also gender-based violence.
The national average is at 18% and Kilifi is at 22%. And according to the Government Health Management Information Systems data for 2018, there were actually 14,000 reported cases of teenage pregnancies. Out of those, 290 were actually for adolescents aged 10 to 14 years, pointing to a clear case of sexual gender-based violence.
25-year-old Nancy is lucky to be alive and to tell her harrowing story.
Wakati alikuwa anataka kunirape, I wanted to shout, but alinionya akaniambia nikishout and if anyone comes in that room because of mimi nimepiga kelele, he can do anything about me. So niliamua tu kunyamaza, akanirape. Alinirape vibaya sana, aliniumiza vibaya sana, na yale majeruhi yenye alinipea mpaka leo naweza sema imebaki kovu katika moyo wangu. It was horrible. I wanted to commit suicide. Nilikuwa nimeamua kabisa, wacha tu nijiue, nikae kama nikufa.
She is among girls and young mothers enrolled in a program called SASA.
SASA is an acronym meaning Start, Awareness, Support, Action. It is an evidence-based curriculum that is used to bring about positive change in the community in relation to gender-based violence, prevention and response. Many times you find that these adolescent girls and young women may not even have sanitary towels to use during their menstruation. So what happens, people can be able to take advantage of them in the name of giving, some little money to be able to buy those sanitary towels. Again, some children or some families go without food. And I think really when they get people who can be able to, buy them some little chips here and there, then you find that then they succumb and they take advantage of them. So poverty is really a real issue that we need to think about economic empowerment for the communities that we're working with so that they can be able to be independent on their own. People should not be able to take advantage of them. They need to stand for their rights and no one should take advantage of them. In the past, they would be shy, they would not be able to talk about issues, especially sensitive issues on sexual reproductive health. But we've been able to talk to them, we've been able to train them, we've been able to hold a lot of sessions with them where we're supporting them for them to know their self-esteem, to know that it is their right to be able to speak out on issues about gender-based violence. And no one should be able to intimidate them. They have a right, as much as they're young people, they have a right to be able to speak out. And they know the power, the power that they have within them to be able to speak. And they know the power they have as a group. They can come together as a group of young girls and adolescent women to be able to speak for their own rights.
As Nancy trains at Mariakani, another team of advocates has been dispatched to Kasidi and Manyanja primary schools to train adolescent girls and boys.
Never touch my private part. hivyo hivyo tayari, si ndio? Tupigie.
Kama mimi mfano niko na rafiki yangu. Yaani si rafiki yangu wa kivulana. Alafu yule ana rafiki yake wa kivulana. Alafu yule rafiki yake yamwambia huu rafiki yangu ati anisetie mimi. Na mimi najua bado ni mwanafunzi, nitafanya nini?
Ukiona anakuongoza ndivyo sivyo. Epukana naye pole pole. Hata usimwambie sitaki, sikutaki, wewe unataka kufanya. Haya, na sisi tuko na malengo yetu ya kusoma. Tutakuwa kama haya hapa tutaendelea kusoma.
There is no doubt the project aims at changing the social norms in the community.
Unagonga kusinzia. Ni nini sasa? Wauma. Vyombo huoshi, nguo hufui. Hata sioni yani nimeona mabadiliko ya kutosha hapa nyumbani. Maana wauma.
Ni kaka, si ndio munafiki sana.
Maana wewe huyu usigombea.
Siku nyingine alipoenda kwa bwanake, si ni bibi yako amekuja. Alafu kumbe huyo bibi ameambukizwa. Akaenda. Na yeye sasa yatoka nyumbani. Si lazima ukae naye. Ndio hawa wakaanza huo mfumo. Alafu ile ni nani atakayechukua hizi habari na kuzipeleka kule nyanjani?
This involves engagement with religious leaders, male champions, youth groups, and media organizations.
So kuna zile walisambeza tokea kwa nyumba kama tufungue page hapo katikati. Kuna physical violence, ndio kwa ya kupiga hiyo za kwa unapiga mtu kwenye kupiga ngumi na kontre na sukuma. Sexual violence, ndio kesi mtu kwenye kwa tendo lile la ngono. Na kuna nyingine alafu kuna emotional violence, ndio sasa unatukana mtu mpaka unamwacha akiwa na stress vile hizo na kwa emotional itakuwa ni affect hiyo.
Si yule umekanyaga kwa nyumba, bibi umepata na makosa fulani. Wewe acha mambo yako bwana, uanze kumharass. Ile unatumia power vibaya.
Sisi waume sengine hatuzungumzi. Maana ukisema tushatokewa na visa hapa Rabai, tushaona mtu akapigwa na mkewe mpaka ikawa ni mambo ya hiyo. Hatusemi.
After all the experiences the victims have been through, it will take a few days of counseling. Today's therapy session is the last one. The project also works with a local gender advisory committee consisting of the sub-county health management team, Kaya elders, and law enforcement officials who oversee activities during implementation and provide feedback to inform programming.
Mimi ni male champion. Mwanamume alikuwa jiona tu ndiye ni mume ndiye kila kitu ndani ya nyumba, kwa hiyo alikuwa anafanya maamuzi hata mengine hayafai, lakini kwa sababu yeye ni mume ajiita ndiye mkubwa cha nyumba. Lakini kutoka ile shirika hili basi wengi sasa wameanza kwa haki za nini mke ni nani, kwa sababu kuna haki na mke.
Mimi kama advocate, kama male champion, ninaposimama kuhamasisha wanaume na wanawake na vijana. Lakini swala sana muhimu sana ni kwa sisi wanaume tujihusishe na kuendeleza hili jambo kwamba tunalipinga.
Already we are noticing a decrease in the cases of SGBV, and also even the cases of teenage pregnancies have been on a reduction. One important thing about this project is that we have been able to train the male champions. These male champions have been very instrumental in reaching out to the community, trying to do behavior change, and also passing around the message of gender-based violence.
Today, the results are amazing.
Tukiwa hapa kama male champion, tunasema kwamba unapomdhulumu mtu yeyote, kumpiga mkeo bila sababu, akitupatia report, sisi tunachukua hatua ya kukupeleka wewe mbele.
Ile kitu imeniinspire mimi mpaka nikama GBV champion. Nilikuwa nataka watu wajitokeze, wasichana, wamama, watoto, wale wote ambao tumekuwa raped. Tujitokeze, tuwe na sauti moja.
The management of those people who come to our facilities, having had cases of SGBV and gender-based violence, has improved because we've been able to train or reorientate the healthcare workers on these matters, and now we are providing better services. We are able to receive PRC kits, and this has been very instrumental in trying to help the the healthcare workers to provide better and more effective and efficient services.
But challenges remain.
The community itself, when they report the case, you might do all the due processes, but at the end of it, you might find some family members come and they tell you, we are just decided to solve this problem at home, or we are just going to deal with this issue at a family level, so we don't want it to be reported.
Poverty levels in Kilifi is a bit high, and in as much as yes, we are mobilizing communities, we are sensitizing them on gender-based violence, but still, without economic empowerment, it becomes a bit difficult for us to realize our goal. So going forward, we would like to either partner with organizations that would empower the communities economically, or look for funding that can also be able to support these young people, especially the teenage girls who have dropped out of schools, teenage girls, married adolescents. They need to have some source of income that can be able to support them.
At this inception stages, we had challenges, especially convening public gatherings, but working closely with the local administration and the community and different stakeholders, we were able to navigate. And again, the perennial challenge of, again, the community expecting some money or some stipend in return for just participating, but working with stakeholders and doing continuous community sensitization, we were able to overcome the challenges.
We'd like to thank Amplify Change for strengthening HFG's capacity. They supported the development of the strategic plan that is currently on up to the year 2025. They've also been able to support us purchase a new financial software that we're currently rolling out. They also built our capacity, especially for our staff, in advocacy on sexual reproductive health rights, and also managed to support us review our policies and came up with a whistleblower policy that then would go a long way for people to respond to issues of fraud and even gender-based violence cases in the community. So we thank them so much because they're flexible and they're cognizant that local organizations also need to grow. We also want to appreciate the county government of Kilifi and the general community and the key stakeholders we've been able to work with. Particularly the Rabai Health Sub-County has been really very instrumental, and I would want to appreciate the clinical officer, the facility in charges, and the entire team for giving us a very good time working together and supporting the community.